Well, here we are. This is my first cameo using my equipment, setting up in north of Bali in a little villa, and there's construction going on. But we have tried for possibly 6 months now to try and get this podcast going. So nothing's going to stop us.
Love it.
Love to meet you. Lovely to meet you and have you on the podcast. Um, First of all, Doc, you MD,
Yes.
dermatologist, NYC trained. We met through my melanoma that I had and posted, and you reached out to me and started giving me some advice. And you don't know how helpful that was, knowing that someone of your caliber was at my fingertips.
Oh, I was happy to be there. I was so sorry that you were going through it, but I thought one is it was so generous of you to share your story and help people understand what you went through and how it took so long to get the diagnosis. And I wanted to share that because I thought it was an important message, and you have such a presence. Everybody who I told that I'm doing this podcast with you, they're so excited to watch it. I mean, this is America. We're across the world from you, and people here are really following your story. So you sharing your story is literally saving lives. So if there's any information I can help share with you that will help get the message out that one, you're not alone if you're going through this. There's a lot you can do. And the information is so hopeful about treatments, survival, long-term survival, overall health, and then most importantly, how to protect loved ones around you who might be at risk because you have a melanoma, and also what you can do to make sure you don't get another one.
Yeah, look, I just did a post yesterday with the American Cancer Society, and the amount of people that actually speak up about the things that are not going right, and what their loved ones or their family are going through or themselves is huge. I get a big feedback, so I kind of feel as I feel as I, it's melanoma, it's skin cancer, it's very popular. Everyone goes through. 1 in 2 in 3 Australians go through it. 1 in 5 Americans go through it.
That's right.
Um, it seems very common, but I think that could be an issue because when you think of how common it is, people might just think, okay, it's going to happen. However, with with that much percentage of it happening, there is a big percentage of it not being good and,
Well, let's break it
not
down.
curable.
So 2 in 3 Australians, 1 in 5 Americans will experience skin cancer, but fortunately, only 2 to 3% of those will be the most significant one, which is melanoma. The most common one is basal cell carcinoma. And that's not only the most common skin cancer, that's the most common cancer. So if you ever get the cancer word and they tell you you have basal cell of the skin, you should breathe a sigh of relief because it's common enough that it's more common than any other cancer. Often many cancers combined, lung, prostate, and breast cancer combined. Like that many people get basal cell carcinoma, but it's the slowest growing. It tends to stay local. It usually happens in more generally sun exposed areas. And we treat it if it's early enough, even with just a cream or with light therapy, not UV light therapy exactly, but with light therapy. And then the second most common type is squamous cell carcinoma. Grows a little bit faster and also more in chronically sun exposed areas. The difference with melanoma from the first two, well, fortunately, it's the least common, but it is the most important in terms of long-term survival. But melanoma is from a cell that lives in the skin called a melanocyte. Melanocyte is what gives your skin its color, gives it pigment. So it's not actually a cell that makes skin. It's a cell that lives in skin and helps protect the skin from getting cancer. So when you get exposed to UV rays, those rays start to hit your skin cells, and then the melanocytes, the cells that make pigment, will now wake up because they get stimulated, and they'll make pigment that will sit on top of the DNA of your skin cells like an umbrella or a sunbrella and try to protect the DNA. Now, if you're really fair skin, if you're light skin, or if you have a lot of sun exposure, and if you have a genetic propensity where you already have some mutations that make you more predisposed to getting cancer, you don't need as much UV rays, and those melanocytes may not be able to protect you at all. You just burn when you go in the sun. You don't even tan. So But the melanocytes, when you get that sunburn, your skin cells generally die off, and then you make new skin cells. But the melanocytes don't die off, they just get damaged. And that's why sunburns are more significant for melanoma than chronic sun exposure. And if you have a melanoma, any first degree relative, your children, your siblings, your parent, first degree relatives now also have a higher risk, and they need to be checked more frequently.
That's that's definitely something I learned. Well, let's face it. Growing up in Australia, we played a lot of sport in the sun. I just had a friend reach out yesterday who actually has just had more taken out of a skin cancer in the same spot that he actually had taken out 5 years ago. So he's really concerned now because it's come up in the same area. However, we spoke about it: surfing, playing cricket, which is like baseball. We're outside all day in the sun. Now, our generation back then was a little bit blasé about it all. I feel the generation in between have really protected their young ones in the sun. It's a big one. They understand. But I'm also seeing a new trend with the next generation talk, making tan lines, a cool thing to have, and being two toned with bikini lines and stuff. And I don't think the message is being spread on to this new generation. I think they need to be told because, like you said, it's not what happened last week or last month or last year. It's actually what happened years ago when you got a sunburn, and now it's coming up to play in your later life. So it's a responsibility from us as adults and parents that we need to protect the children.
Absolutely. I talk to patients all day, every day, and I try to tell my younger patients. So I come up with all these different lines. I used to say, well, your 50-year-old self, when I was in my 50s, I'm past that now, but I would say your 50-year-old self is telling you, please wear sunscreen. It's so important for later. Nah, eyes roll over. If I said, well, if you use sunscreen, but you tan, the tan still counts. Nah, they don't care. But I came up with a line that all of a sudden I saw eyes pop and they're like, oh, I get that. And the line was, nothing looks more beautiful in your 50s than sun protection in your 20s. And so that
That's
line
right.
really resonated. And so I started using it more and more and more because if you find a line that works, that's why your presence is so important. Because when you say, this happened to me and I'm going through this and this is how it changed my life, people will listen. So part of it is getting people to listen and to understand that this is significant. It's both affecting how you look, how you age, and it's also affecting potentially your life. But the problem is that there's a lot of information I'm seeing on social media talking about the benefits of sun. Like people with millions of followers are talking about how sun is essential and get 20 to 30 minutes of sunlight in the middle of the day several times a week. Now, to me, I get how important the sun is. I want people outdoors enjoying their time. But the reality is to give a message that going out and getting sun without sunglasses and without sun protection is a good thing for your skin because your skin is an endocrine organ and you need sun for life and vitamin D is absolute nonsense. I do think that early in the morning when the UV index is below 3, it's good to go outside and get some light because that is the safer time to be out and it does help set your circadian rhythm. But if you have very fair skin and you burn in 5 to 10 minutes, that 23 minutes or 20 to 30 minutes is going to cook your skin and cause skin cancer over time. So anytime you hear something, you have to put it into the context of what is your skin type and what is this really saying? There's a lot of nuance. Your eyes do have melanocytes in them and they have sensors that can sense light that helps set your circadian rhythm and may even affect how you tan, but that's not at 12 o'clock when the UV rays are strongest. So a little bit of information is problematic, and then people look for sources that validate what they want to do. So
Yeah.
as dermatologists, we're out there saying, wait a second, we're picking up melanomas. It's one of the highest cancer killers in women in their 20s. That's
Wow.
crazy. So
Yeah. Look,
get the message.
vitamin D is important, and I was always an advocate for that. But look, someone said to me the other week, "Oh, gee, you're white," and I went, "Yeah, good." Like that's whereas years ago or even before this, I would have just went, yeah, I haven't been out too long, a bit, I haven't been working or whatever. But now I'm actually looking at myself and go, yeah, I'm great, good,
Me,
I'm
yeah,
white.
I
Whereas
love it.
before, I didn't try and burn. It was just my occupation, and I wasn't really paying too much attention to it. And I do feel very naive about doing that. But going back on I want to go back onto your social media as well. There's one thing that I see about your social media, which is a great following. It's huge. Is your little short clips about everything with dermatology. They all have just a really highlighted topic for people to actually come into. And I think it's important, someone like yourself, an MD, um, getting on there, getting on a social media, telling the world the right things to be done. Because one of the biggest problems with dermatology or actually health in general is actually finding a slot, especially for me as a traveler, finding an opportunity to take some time out to book a place that I have to book 2 months in advance or a month in advance, and then go and have that um, skin cancer check. I had my third skin cancer check in the last 6 months the other day. It's all fine. When I go
Yeah.
back to Australia, I'm going to book in for the PET test, but I I don't find it easy to find the time. Now, if we've got someone like yourself on social media that's pushing out these correct methods and issues, that's where people should turn to, especially if they've actually been diagnosed or they're a bit concerned. You're giving people an opportunity to do some research so they can be less naive than probably what I was.
Thank you. I love that. One thing about the vitamin D that I think is really interesting is people do think that the sun is the best way to get vitamin D, but vitamin D is naturally found in food. So it's in eggs, it's in nuts, it's in fortified food, and you can get it from a supplement, and it's really the active form. So for people who think that the sun is the only way to get it, sun is naturally found in other sources besides the sun. So you really don't need the sun for vitamin D. And actually, if you get too much sun, your skin will break down vitamin D because it doesn't want to lead to toxicity. And if you have sun damaged skin, it's not very efficient at making vitamin D. So all of those things point to the sun is not the best source or way of making vitamin D. And those are the kind of myths I really do try to bust on my social media, as well as really being positive and highlighting all the control that you do have. So one is, if you see something that looks suspicious, show your doctor. Don't panic. But what I found is that people really worry about things that are raised when melanoma most of the time is flat. So when we have like our ABCDEs, the simple way that we sort of explain the changes that you look for in a brown spot that might signal that it could be harmful, there's no R for raised. It's asymmetry. So if it's not symmetric, if it has irregular borders, if it has variation in color, if it's evolving, if it's changed from the way it looks, and if it's growing in size, those are the ABCDEs. And but people will point out something that's raised that they've had forever that they really worry about and lose sleep over, and they're missing the spot next to it that's flat but that's changed that I worry about. And we have special tools like dermatoscopes that we can look at your skin and good lighting, and we look from head to toe. So, yeah, it's so important to find reputable physicians on social media who will give you information and sort of help navigate what's real from, when you can get safe sun exposure and when you need to be more careful. But melanoma also sometimes is not related to sun. Sometimes it happens on the bottom of the feet or in areas like I've seen melanoma in the belly button or in the crease of the butt, like areas where they didn't get sun. So we do have to check everywhere for that.
Yeah, definitely. As I said, my dad just got another one moved out just under his eye, and yeah, he's got Alzheimer's now, so that's another thing. So getting back on what you said as well with vitamin D, let's talk about sunscreens. Are they
Yeah.
good? Or are they bad? Like that's the thing. Like everyone says, the chemicals. You can get more mineral-based ones with less chemicals. I'm sure it's the selection or just the propaganda around it, I suppose, is the word. Probably not the word. You spoke earlier about people looking for excuses to be out in the sun or, finding that's exactly what sunscreen is. Now they're saying, well, it's not good for you. It's got chemicals in it. What's your thoughts on that?
Well, first of all, everything's a chemical. We're all chemicals. So I think we live with chemicals, and there's good ones and ones that aren't so good. So when it comes to sunscreens, the ones that are available in the US are regulated by the FDA as drugs. So they have very specific rules about what can be used or as and labeled as a sunscreen, and the safety testing is critical. So we don't have new sunscreen ingredients in the US for what, close to 20 years now, and a lot of that is because a lot of the sunscreens available in other countries and around the world don't have the safety tests that satisfy the FDA. Hopefully we'll have some changes and that will be easier to get through. I actually think European sunscreen filters and the ones in Australia are better than what we have in the US. So whenever I leave the US, I buy sunscreens abroad, because even the same brand name sunscreens have different ingredients outside of the US and in the US. So now there's
I've
two
heard,
different
yeah,
general categories.
yeah, I've heard
So
that I know a few people from America that do that. They buy a lot of Australian products or UK
yeah,
products. I have heard that the American government is 16 years behind on catching up onto the rest of the world in their use of sunscreens.
yeah, it's terrible, and we need to do better, but it's what we have. So there's two general categories, as you were kind of saying, with chemical and mineral. So what we call chemical are ones that absorb the UV rays. The mineral ones reflect the UV rays. But what people don't seem to understand, and what's really important, is that both of them are absorbed into the skin, not through the skin, but into the skin. The ones that
Right.
people call chemical, which are the avobenzones and the cinnamates, and some of them have fancy names because they make molecules out of them and they stabilize them to get longer wavelengths of protection. Those ones might somehow get through the skin into the bloodstream as well, and that's where people have some concerns. But the mineral ones, which are mostly zinc based and sometimes titanium, they go into the outer layers of the skin and they reflect UV rays. So the reason I like those is because the UV rays don't get absorbed into the skin and converted into heat. So if someone is prone to melasma or you're very active outdoors, the mineral ones are better. You'll stay cooler and more comfortable. But what sets them apart that people don't like is that they often look like you're wearing sunscreen. So sometimes it can look pasty depending
Yeah.
on the amount of zinc or titanium in it. And the ones that we're calling chemical that are more absorbed can often be way more cosmetically elegant, but they do absorb the UV rays, convert it to heat. And sometimes if you're prone to pigmentation, that can be an issue for some people.
Yeah, we need to make sunscreen look cool. Maybe some pastel colors or something. Also, what about heavy metals? You talked about diets and getting vitamin D through food. What's the relationship, if you think there is any, with the heavy metals that are actually in our body, and that being the trigger for the UV actually sparking off some issues?
Heavy metals are such a problem because our food supply and people take so many vitamins and the sources are not clear, and there's a lot of heavy metal which can, I believe, be a big source of skin cancer and so many problems. And it should be addressed. We should be more comfortable measuring heavy metals. It's not a common test done in the US. If you go to a special doctor, and I go to a functional medicine doctor, they'll check for things like that, but most doctors don't on average check, and sometimes there's not much we can do except try to find the source. So I would say, if you're getting vitamins, even from someplace like Amazon or a site like that, there's still authorized sources there. So I would just be careful about where you're getting product. Don't look for shortcuts. There's a lot of counterfeit product that is way contaminated in both spices, like a lot of turmeric that people take is contaminated with heavy metals. And this wreaks havoc in so many ways, but especially skin cancer. We know arsenic is a big cause of skin cancer. So if you drink well water, that can be contaminated with arsenic,
Wow.
and that really increases your risk of skin cancer. So yeah, I think it's a big problem, but we know the sun exposure is an issue. So it
Yes.
doesn't mean that if you don't have heavy metals, you don't have to worry about the sun. And with you saying that people say you look light, I always say go with your own glow. I think your color looks great. So you're
Yeah.
celebrating the tone that you have, and that's
Yeah.
awesome. So I think sun protective clothing, if you're in a place like Australia where the UV rays, especially in your summer, can be so intense. I don't think any SPF for somebody who's very fair is enough. At that point, you have to be what I call sun smart. It's limiting midday exposure, trying to stay in the shade when you can, having your activities, if you're outdoor, being physical, playing or running or cycling or doing anything, try to go way earlier and later in the day, and then wear some protective clothing, and certainly protect your eyes, because melanoma can also occur in the eyes because we have melanin in the eyes.
Yeah, look, that's one thing that's very significant in my life now is protection. And this obviously was a bit of a scare and a wake up, and it hasn't gone away. It's obviously in me. So I need to actually keep on top of it and keep my checks going. But if anything, it's really made me be a bit of a helicopter dad around my daughter now. I'm like,
Good.
yeah, wait, no, come on, stop. And she understands. She watched me. She saw the scar. She saw the stitches. She asked what it was. I told her. I explained to her. So now she's more understanding. And I think that's what we're trying to do here is raise awareness for the people. Well, firstly, for our generation that are going to come across this, most definitely. The percentages are high, but go out and get checked now. But also pass it on to your grandkids or your children to be a bit safer
No,
now. Because as you
I
said,
think. Oh, tell me,
your
tell
motto,
me.
what was your motto again? Your
Nothing
20s?
looks more beautiful in your 50s than sun protection in your 20s. Yeah,
I love it.
or your
I
teens.
love it.
But also, I think sometimes when these things happen that are upsetting and difficult and scary, I think there you I came up with a line just from childhood things that happened to me, is that sometimes you have to make something good out of something, even when it has no good in it at all. So there's no good in what happened to you, that melanoma. There was no good in it, but you're making something good out of it. And you're making a difference for your daughter. Not only are you lowering and protecting her from getting skin cancer, but she's going to be gorgeous when she hits her 50s and 60s, because she's protecting her collagen, her skin, and it takes 30 to 40 years for the damage to show. So you're being the best dad. You're educating your daughter. She's going to be a role model for other kids, and you literally are saving lives, saving beauty, saving health. And you're not telling people not to go outside. You're just telling them to be smart about it. And if they see something on their body that doesn't look right, show your doctor, and sometimes ask for it to be checked and persist if it looks different to you. I know that you did that you noticed, and then you went back and showed them again.
Yeah. Look, as I think one of the biggest lessons I learned was I went to a GP, they looked at it and they said it's fine. And then later on, I went to a dermatologist here and they were very concerned and they took a biopsy. And then it all just started unraveling. When I got to Australia, they wanted me to come back in Bali. They wanted me to take more out. Then when I was in Australia, they're like, what's going on here? Why are they taking so much out without the right report? And I was like, what's the right report? Look, so it's so important that you find a dermatologist, I feel, that you can actually revisit and trust and understand. And they've got some reviews, and you understand that they are good at what they do, and you keep going back to them. And that is one of the biggest things. It's hard to find that time. But I'll tell you what, when it happens to you, you find that time. As I said, I've had 2 checks now. And funny enough, you said about the raised mole. I've got one here that kind of felt like it raised. And obviously, with what went on, I started to have a bit of a panic. And
Mhm.
they said, no, that's fine. That's fine. They actually said there's one on my back that they're more concerned about that's got a little bit of two tone. They
Yep.
said, I would like to check on that in 3 months' time. So and I will do that when I'm in Australia. So that's good. Like, so it's exactly what you said. The one that I was concerned about was no problem. And there's one on my back, which I wouldn't have seen, which wasn't brought up in my last check. So what do? You try and keep a routine, a continuous check in with the same dermatologist, I think, because that's what I'm seeing, that there's different people with different thoughts. So find your dermatologist, go to your regular checks, have the full analysis done, and then it's documented and you can see the changes.
Beautiful. I love it. I'm so grateful for your messaging and for telling the story and getting to meet you. And I know you're going to come visit New York one of these days. Hopefully not when we're having a heat wave.
Yeah, no, I know it's happening everywhere. I will be over there for the gala, which I think you're going to, and the
Yeah.
end of October for the Melanoma Research Foundation.
Yes.
And I'm looking forward to that. I'll be learning a lot more for that, and I'll be back in America a few times, definitely after when it cools down a little bit. But for now, I'm actually in Bali.
All right. Well, next time maybe we'll do it live from Bali.
I think, yeah, that would be good. I do apologize for this makeshift podcast setup. However, I wanted to get away from the tourists. I'm up in the mountains. I'm with the waterfalls. I'm in the cooler climate. Actually, going to be going free diving for the next 4 days. So I'll be going down to the water and getting under the water, away from the sun. But I'll be slip, slopping, and slap, as they say in Australia, where we slip on a hat, slap on some sunscreen, and slap on a shirt, and be
Wait,
definitely
I
looking
wanted to
after
tell
my
you two
skin.
more things about that. What you just said was so important. There's a few things. One is that the UV rays don't make heat. So even if it's cold, those UV rays are still very present. So you can't say I'm not hot, therefore I don't need sunscreen. When you're
Good
at
point.
higher altitude, the UV rays are more intense. So when you go up into the mountains, the higher you go, the more intense the rays. And when you're in the water and you're wet, the UV rays can also penetrate both. They can go down to 3 meters, and also they reflect off the water. So those are three great examples of when you need to be extra, extra careful.
Yeah, I can tell you, I can't tell you how much I've come home red from the reflection of the sun. And I will tell you a little funny story. When I was a plumber when I was younger too. I was a mechanic and then a plumber, and I used to do a lot of metal roofing, the sheeting.
Wow.
Um, and you learn very quickly to cover up your shorts when the reflection of that metal sheeting goes up in between your legs. It's a bad day the next day.
That sounds very painful. Ouch.
You learn
That
very
burn
quickly
is not pleasant.
as an apprentice. You learn very quickly. Okay, tight shorts from now on. Be quite honest. There's one thing that's look, when a doctor looks as good as you at
Oh,
your age,
thank you.
I don't think anyone could not follow your advice.
Oh, thank you. You just made my day. Thank you.
You look amazing. I think your voice is amazing out there. I love watching your little clips. It brings you in. I think it brings a lot of people in about many many skin issues, conditions, or advice. And I I think we need more of MDs out there flushing out the nonsense.
Yeah, I agree. Thank you. So good to see you.
Thanks. You too. I can't wait to meet you in person. It'll be very soon, I'm sure.
Look forward to it.
Look, I've been trying to get you here for so long, and I can't believe that the only day lined up with me having to run away up into the mountains. But I have to do it. I think it's good for my sanity to get away from all the noise.
Good
And
for your health, for sure.
I just my everything just feels a lot different if I'm just in nature. So I do it regularly.
I agree. Have a
Thanks.
great
I
day.
really appreciate it.
Me too.
Thanks, Dr.
Take care.
Doris.
Bye.
Bye.
Great. Me too. Bye.
Bye.